This is adapted from the 5-week Yin Yoga-Based Interventions, Decreased Plasma Adrenomedulin, and Increased Psychological Health in Stressed Adults, a randomized controlled trial. This was published in the National Library of Medicine, National Institute of Health in 2018. Jacobus van Wouwe was the editor. Abstract background. Non-communicable diseases, such as cardiovascular disease, are responsible for high rates of morbidity and the majority of premature deaths worldwide. It's necessary to develop preventative interventions that can reduce the associated risks of NCDs. Researchers have found that the biomarker adrenomedulin, or ADM, becomes elevated years before the onset of NCDs and might play an important role in their development. ADM has also been linked to psychological problems such as stress, anxiety, and depression, which are known risk factors of NCDs. In this randomized controlled trial, we examined whether participating in a 5-week yoga intervention reduces ADM and increases psychological health in middle-aged adults who self-report as moderately to highly stressed, but who otherwise exhibit no physical complaints. Methods. 105 adults, 78% women, mean age 53.5, were randomly assigned to a 5-week Yin Yoga intervention, or a 5-week intervention combining Yin Yoga with psychoeducation and mindfulness practice called the YOMI program, or 3, a control group who did not practice yoga or mindfulness for 5 weeks. Results. Compared to the control group, we observed significantly greater pre-post reductions in plasma ADM levels, anxiety, and sleep problems in both intervention groups. Furthermore, the YOMI group exclusively showed significantly greater pre-post reductions in stress and depression compared to the control group. So the YOMI group was the one that got the Yin Yoga with the psychoeducation and the mindfulness practice. The other treatment group got only the Yin Yoga intervention. Significant correlations were found between pre-post reductions in ADM and anxiety symptoms and depression in the entire sample. Conclusion. The 5-week Yin-based interventions appeared to reduce both the physiological and the psychological risk factors associated with NCDs. The study suggests that incorporating Yin Yoga could be an easy and low-cost method of limiting the negative health effects associated with high stress. Introduction. Non-communicable diseases, NCDs, especially cardiovascular disease, CVD, and cancer, are responsible for high morbidity rates and the majority of deaths worldwide. Besides well-known preventative interventions recommended in the healthcare systems, such as smoking cessation, improved dietary habits, and increased physical activity, practicing yoga has been the subject of recent interest as a possible way of improving the risk factors associated with NCDs. Accordingly, medical professionals are debating whether yoga practice should be included in future health recommendations. They are covered by insurance now for heart disease and cancer. In this study, we examined the effects of 2 Yin Yoga-Based interventions on the vasoactive peptide adrenomedulin ADM and common psychological risk factors of NCDs, including stress, anxiety, depression, and insomnia. ADM is secreted from many organs, including the endothelium. It mediates vasodilation, angiogenesis, and growth modulation, and thus exerts both growth-promoting and growth-inhibitory effects on cells. Importantly, plasma ADM levels are elevated years before the onset of several major NCDs. Particularly high concentrations in healthy individuals strongly and independently predict the later development of CVD and cancer, as well as premature mortality. In acute conditions of vascular and cardiac stress, ADM is one of the strongest predictors of death known to date. Although there are no agreed upon thresholds for plasma ADM concentrations, measurements in healthy control subjects indicate that normal concentrations are 1 to 10 parts per million. Increased ADM concentrations may be compensatory mechanisms of elevated blood pressure. ADM concentrations also increase with body mass index, BMI, and are elevated in people with chronic conditions such as congestive heart failure, hypertension, and renal disease. However, ADM concentrations might rise without concomitant pathology, such as during exercise, or rapidly change during orthostatic challenges. While there is much evidence linking ADM with stress, anxiety, and depression, it is still premature to conclude that these relationships are causal. In a study on rodents, stress stimuli known to increase sympathetic activity led to elevated ADM in the pituitary gland, plasma, and adrenals, suggesting that it modulates hypothalamic pituitary adrenal axis activity. Elevated ADM was found in patients with major depression, and according to a large population-based study, plasma ADM partly explains the relationship between depressive symptoms and mortality risk during long-term follow-ups. The results have been mixed for anxiety disorders, with one study finding elevated ADM levels in such patients, but another finding reduced levels. Thus, more research is needed. Yoga is an umbrella term for various physical, mental, and spiritual practices originating in ancient India. In Western society, its best known form is Hatha Yoga, which generally entails performing sequences of physical postures combined with deep breathing in a controlled and mindful manner. Mindfulness, which Kabat-Zinn refers to as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally, is an essential aspect of yoga practice. Yin Yoga, the basis for the interventions examined in this study, is a calmer, more meditative form of yoga that uses seated and lying postures, held for 3 to 5 minutes while maintaining deep breathing. It is derived from Hatha Yoga. It focuses on calmness and mindfulness. It makes Yin Yoga a tool for relaxation and stress coping, thereby improving psychological health. As such, Yin Yoga may help lower perceived levels of stress and anxiety, which in turn may reduce the physiological and psychological risk factors associated with NCD. Yoga can improve various psychological health-related factors, including stress, anxiety, depression, and sleep problems, all of which are associated with NCDs. While practicing yoga may not reduce the challenges or stressors of daily life, it may provide tools for coping with them, thus reducing the negative health impacts of stress. The YOMI program, which combines Yin Yoga with psychoeducation, produced significant pre-post reductions in stress and worry among young moderately to highly stressed adults. In line with this previous study, we expected this combination of Yin Yoga and psychoeducation to have stronger health beneficial effects than Yin Yoga alone. This randomized controlled trial tested the following hypotheses. 1. 5-week interventions combining Yin Yoga with psychoeducation, the YOMI program, and Yin Yoga practice alone. Reduce levels of ADM, perceived stress, anxiety, depression, and sleep problems to a greater extent than the control group. And 2. Pre-post changes in ADM are related to pre-post changes in the psychological health variables.